Yo, yo, yo. You can actually get a T-shirt that says yo, yo, yo at ArmstrongandGetty.com, and I'm wearing an Armstrong and Getty hat today, which kind of makes me a bit of a DB, wearing hats that advertise my own thing, but whatever. It's going to keep the rain off my head today.
Good company, man.
Exactly. That's all I am. So, Joe's not here. He was just on a little bit ago. He had surgery on Friday, and I thought it'd be an opportunity to talk to Craig, the healthcare guru, Craig Gottwals, and we'll tell you about his website and stuff in a little bit. Just to go through some of the crap that's being thrown around about healthcare by all the candidates. Craig Gottwals joins the show. Hey, Craig, how you doing?
I'm good, Jack. I made the mistake of listening to your newscast there and hearing about the first Womixon in California.
Yeah.
It kind of started me off with a low will to live here on this segment.
That'll do it. So I know you've been watching the debates, including the one last week, and they're talking their healthcare talk. And I always like texting with you because you understand this at the micro level, this healthcare stuff. What are people saying that makes sense, doesn't make sense, is a complete lie, etc.?
Well, the thing that I want your listeners to understand first and foremost is that whether you take the Bernie Sanders approach of we're all going Medicare for all year one, or the Liz Warren approach of we're going Medicare for all by year 3, or the Pete Buttigieg approach of we're going to go Medicare for all who want it. Rest assured, that is the same policy that we will be completely socialized and we will all be Medicare for all by 2028. If you give them 2 terms under any of those circumstances, they all end in the same finish line. And the reason, it's just, honestly, the Pete Buttigieg, even throw Biden in there, their approach is just politically smarter because they're not telling you they're going to force you onto something. But they know darn well that once they open up Medicare for people that are under 65, for the general public as a whole, they know that they're going to crowd out private medicine. And it's just a matter of 4 to 6 years before all private health care as we know it is gone.
Okay, so why would that happen? Explain that to me in a way that I can understand. Okay. Pete Buttigieg is Medicare for those who want it. I say, no, I'm not doing that. I'm going to stay on my company's insurance policy.
Sure.
How or why would I eventually end up on the government policy?
Well, it's the same fatal conceit the Obama administration had when they said everybody who likes their plan can keep their plan. Now, some people in the administration may have thought that, but I think honestly, more of them were just cynically saying that. It was a political reason, because imagine what happened then. We rewrote 1/5 of the American economy with 75,000 new pages of laws, rules, regulations, and court cases on health care. We completely changed the roadmap for the, at the time, roughly 50% of people in our country who got health care from the employer. We completely changed every rule, every regulation, every way that was done. And the fatal assumption was, oh, well, all employers will just continue to offer the same plan. Well, of course not. You just changed all of the rules. So employers are going to begin to act incredibly differently. And what happened in the Obamacare switch was, what that meant was passing on much larger deductibles and coinsurance and out-of-pocket maximums to the employees. So the promise of if you like your plan, you can keep it. I used to say back in 2009, I used to say, yeah, that'll be true if insurance prices never go up, no employer changes its economic reaction, and unicorns fly through California like they have now for the past 8 years. It's completely a misunderstanding of how the market works.
So at some point, because as you just explained, when Obamacare hit, all of a sudden, I think this is true for a lot of people listening right now, you spent most of your life with a deductible so low you didn't even really pay any attention to it, to where your deductible is so high, it's almost like you don't have insurance unless something catastrophic happens. My deductible, I think, for my family is $3,500. Well, unless something major happens, I just pay cash for everything. I'm just paying for everything. So that changed a lot. So you'd say it would get expensive enough that at some point I would throw up my hands and I would say, you know what, I'm going on the Medicare thing.
Well, yeah, exactly. So the other thing we've talked about on your show a lot over the past couple of years is, and it's worth repeating because people listening should never forget this, all of the government programs, set aside the VA, that's different, but Medicare, Medicaid, and Obamacare, the 3 big government programs that the public has access to, those underpay providers by roughly 25% on average. which then forces those providers to overcharge employers and private plans by about 25% just so they can be made whole. Okay. So now if you rejigger the rules such that more people are going to flood from the employer plans into the government plans, you're going to have providers getting hammered, right? Because now I've got more and more people coming in paying a quarter less than what my costs are. So now I, as providers, doctors, hospitals, nurses, are going to have to charge more back to the employers. So you're going to get a death spiral that results because employers are going to be, a smaller percentage of employers are going to be consistently forced to shoulder a larger percentage of the price over time. And you're just going to have smart employers. Imagine two competitors, one who's figured out, oh, I can just give my employees a raise and tell them to go onto the Medicare for All plan. Or I can continue to pay 10 to 20% increases on my employer health care plan year over year over year, while my competitor pays no increases on his plan.
So your boss comes to you and says, hey, I can give you a $10,000 a year raise. I'm going to take you where your health care insurance. I'm going to take you where your health care insurance, but here's the form for filling out. So you go on the government one, which is free. And I'm going to give you a raise.
Right,
you're right. A lot of people would say yes to that.
And that's the number. And now people say, well, Bernie might say, well, we'll make that illegal. We won't allow employers to just dump employees onto the, well, I don't think Bernie would say that, but maybe Elizabeth would say that, right? So then maybe they make it explicitly illegal for you to just give an employee a raise and push them over there. Well, you do it as an employer,
sure.
You do it another way. You increase the deductibles and the copays even higher to make your plan even less desirable, and employees make the choice to go over there.
So can you, because people say this to me all the time, I love the idea of a government healthcare system. What's wrong with that? So I just go in anytime I want. I never pay a bill. I don't even think about it. The government's running it. What's the downside?
Well, I was just reading a study this morning, actually, before I even started texting with you. Latest study, now op-ed in the Wall Street Journal, penned by the Cato Institute. Medicaid alone is now at least at 20% waste, fraud, and abuse. So 1/5 of every dollar we're spending, and that just for Medicaid is roughly $75 billion per year. So it's okay if you're reasonably healthy and you have simple needs and you don't have really complicated needs where you need to get in to see a specialist right now. Socialized medicine works reasonably well. It's like the French economy, nobody's really rich and everybody's just kind of in the middle except for the uber rich bureaucrats who run the country, but that's a different story. So it's the whole impetus of the country, right? I mean, we're not seeing a trend towards individual responsibility in our college campuses, in our tech industry. We're seeing more socialization and more cooperation as kind of the impetus here. And that'll be how medicine goes. And you'll see older doctors retiring. You'll see a brain drain because they're all going to get paid less. And you'll have the longer wait times, and you'll have the less specialized coverage at the higher end. I mean, again, economically speaking, your brightest and best in kids going into college, deciding to go into medical school, will probably opt for more of those industries where they can actually be paid what they're worth and not be shuffled into a giant governmental bureaucracy.
I just have never understood what the counter argument is to look at the DMV. Why won't healthcare be like the DMV? Right. Or look at the VA. Why won't my healthcare be like the VA? What's the argument against that?
I wish I knew, Jack.
Yeah.
I really did. I really wish I knew that, because we're seeing it, like I said, college campuses, tech industry. You mentioned something about the high deductibles, and it's like, this is why me being in this industry, it doesn't make me happy to say this, but we're doomed, because there's two approaches to healthcare here. We're at a turning point, and the two approaches are, one, Bernie Sanders, Elizabeth Warren, socialize everything and just have this kind of mediocrity for everybody. Or two, let's go more individual responsibility, less third-party payment. So let's have these $5,000 deductibles, but let's put tax policy in place that incentivizes individuals to save for their own health care with pre-tax dollars. What do you think is leading right now in the country? I mean, that's just not the winning argument, and that's what needs to happen in order for this to get better.
Well, you have been saying for, I think, as long as we've been having you on the air, that you think government healthcare socialized medicine is coming. It's just a matter of when. You still believe that, I assume?
Yeah, I actually think that if Trump loses the next election, I think by 2028, after 2 terms of a Democrat, I think we'll be socialized. If Trump wins the election, I think it just buys us maybe 2 more years, 2030.
Wow.
And we'll be socialized, because I think whoever comes after Trump is going to be a Democrat. I mean, it would be unprecedented to have it not be a Democrat at that point. And then you're going to just need about 6 years to get it there. Unless, again, some catastrophic change, some massive depression, some war, something crazy could come that really changes the way we think about personal responsibility versus government cooperation. And maybe that's not the right word. Maybe I should say government coercion. I just think that's the direction we're headed, and I don't see any way out. Now, Trump he's a brute. Yeah, some of the stuff he does is completely out of line. It's not perfect by any means, but he's making the right steps in healthcare, just sort of like he's making the right steps in trade policy with China. It's ugly. It's not perfect. It's way overdue, but there's hope. If he gets reelected, there is hope some of this stuff does turn back towards individual responsibility. So
we got to let you go. Craig Gottwals, explain to us why somebody would want to go to your website, benefitrevolution.com.
Benefit-revolution.com. You know, I keep up to date on this stuff. I post the things that I find the most interesting. We've got a catalog of our old segments together there. And of course, you can always find me on Twitter. I'm there as well. That's I don't even know my Twitter handle. I guess I probably should when I do things like this.
At Ben Revolution, at BENE Revolution.
Benny Revolution, there it is.
Yeah,
thanks.
and if you run a business or anything like that and you got healthcare questions, this is the guy to get a hold of, benefit-revolution.com. Craig Gottwals, thanks for coming on today. Appreciate it.
Thank you, Jack.
It's not the most inspiring discussion you're ever going to have, since he thinks it's inevitable that we end up a full government healthcare, and the whole healthcare system, we like the VA. People dying and not getting the coverage they want, and oh God, the cost of it will just be insane because nobody's paying attention to what anything costs. It's all just one big pile of